Mr. Shan is here. He wants to share his experience with the others. His surgery has got like 2 days back. Okay. So, Mr. Shan, do you want to introduce yourself to others?
Yeah, my name is Shan. I'm originally from Eastern Africa, and I'm currently in Europe now for work.
When did you got your surgery done?
2 days ago.
And like when you started your hair loss?
Um, I realized I was starting to lose hair around 2015, 2016, so 8, 9 years ago.
8, 9 years. Okay. So when you did start your research for hair transplant?
I started the research about, I would say, 2 years ago.
2 years ago.
Yeah.
So, can you tell the viewers, like, because where you are living, Turkey is very near to your country. So,
Mhm.
why did you choose Akeso for your hair transplant? Because there are many, like, European patients mainly go to Turkey.
Um, I think that I chose the queso because everything was clear and transparent on their website about the procedure, about the costs, about the role of the surgeon in the procedure. Like everything was clearly explained, and I think I didn't find answers to all those queries on other websites, and also because I think that. Yeah, healthcare in India is pretty good. My yeah, so according to experience in my family, so that's also one reason why I chose India, other than other countries where I could have gone to.
Oh. So, like, when you did your research about hair transplant in India, why do you choose Akeso Hair Clinic in India rather than other clinics in India which are famous for hair transplant?
Um, because I already found out about the queso a few years back, even though I was not yet really considering the hair transplant. I already found out about the queso. I saw all their videos on YouTube. Everything was pretty clear, and yeah, there were also views and yeah, there were like videos about 8, 9 years ago where the surgery was performed by the same doctor. So I thought that this particular doctor has much more experience than any other clinic where I would go, which is like 1 or 2 years old. So I think that the queso, like the team in the queso, has much more experience.
May I ask you, like, who did your graft restriction from your donor area? It was a doctor or his assistants?
So the graft extraction was done by the surgeon himself, and yeah, that was good because it was what was planned and what was how to say what was discussed during the initial discussions and when I arrived. So that was pretty clear, and I was satisfied with that. And also the surgeon was available. Like after he did his job, the assistant's job was to put the grafts back into the cannons. But the surgeon kept coming back every 1 hour to make sure everything was fine, and that I was comfortable, not having pain, and I think that was good.
And who made your complete plan before the surgery? It was surgeon or assistants?
The plan was also made with the surgeon.
And who made the slit or channel making or incisions in
Yeah,
your bald area?
yeah, yeah. That was also made by the surgeon. So when I arrived, I had I had the pre-surgery appointment directly with the surgeon, and he took uh, he took the time to explain and re-explain everything because there were some questions that were still not answered despite already having contact with the assistants. So there was also something good that that the surgeon really took his time to explain and re-explain everything that wasn't clear.
Do you feel that pain is a factor? Like it has been 2 days now after your hair transplant. Do you feel any kind of pain or discomfort right now?
Right now, no. Um, yeah, I'm feeling some sort of heaviness, but I think it's normal after the procedure, but no major pain or discomfort.
Do you want to tell any viewers any kind of message you want to give to the viewers regarding your experience or your research?
Um, yeah, I think that people should be more focused on the doctor who's going to perform the surgery rather than the clinic. Because, for example, when I went to hairdresser, he advised me some clinics in Turkey, and when I checked them, so they were like really big clinics, but I didn't find any information about the surgeon, like his qualification, and if he would really be involved in the surgery, of if the whole process would be done by assistants. So I think that yeah, the focus should be really on uh, who's gonna who's gonna take care of the patient from A to Z, and yeah, I think that's what's most important.
Okay, thank you for your time. Thank you
Thank
very
you.
much.